Hello, I'm Ardith Biakan. I'm presenting integrating methods of quality improvement based on a near miss that occurred at my hospital, which can occur at any other healthcare facility. I'm presenting a case based on a patient who became hypoglycemic. TK is a 69-year-old female who was brought to the ER by a family member and was admitted to the telemetry unit on an observation for uncontrolled hypertension. She has a history of hypertension, obviously, hyperlipidemia, and borderline diabetes. TK has orders to have her blood sugar checked before meals and at bedtime and to receive insulin coverage as needed. And which, by the way, she's never received insulin. Before change of shift at 6:30 a.m., Nurse Jackie checks TK's blood sugar, which was about 316 milligrams per deciliter. Normally, the next shift will cover the insulin scheduled at 7:30 a.m., which is about 15 to 30 minutes before breakfast trays arrive. Nurse Jackie is a new nurse who has been on her own in the last week following a preceptor for training for about only 2 weeks. Nurse Jackie decides to administer insulin coverage right away. She had another nurse co-sign the insulin who verified the coverage needed on the computer, but was too busy passing her medications to question why the insulin was being administered that early. At change of shift, Nurse Jackie and incoming Nurse Tom come to TK's bedside at 7:15 a.m. and notice that TK is complaining of dizziness, lightheadedness, and is somewhat confused as to where she is at. Nurse Jackie reported that TK did not have any complaints throughout her shift and is now presenting with these acute complaints. Nurse Tom then asked Nurse Jackie if TK was given any medication in the last few hours. Nurse Jackie reported that the only thing that was given to TK was insulin, which was within the hour window, as she explained, and that she knew her breakfast tray would come at 7:30. This alerted Nurse Tom, who immediately checked TK's blood sugar, which was now at 660. TK was then given orange juice, a graham cracker, and glucagon per protocol. Nurse Jackie seemed worried and then remembered that Humalog is a fast-acting insulin. After 45 minutes, Nurse Tom rechecked TK's blood sugar, which was now normal at 95, and noted that TK was alert and fully oriented and no longer complained of dizziness or lightheadedness. And by that time, TK's breakfast tray arrived, which was approximately at 8 a.m.